Have you ever had an allergic reaction, or maybe a bad migraine, or even just heartburn? Well, if you have, then you've actually had a run-in with the two tiny but incredibly powerful chemical messengers we're going to talk about today. Let's dive into the amazing story of histamine and serotonin. So let's start with a question you've probably asked yourself. Why is it that an allergy pill can totally knock you out and make you drowsy, but a pill for heartburn, which also deals with a bodily chemical, doesn't? The answer is just a brilliant story of how our bodies work, and even cooler, how science has figured out how to precisely hack that system. You see, the key to all of this lies with a special group of chemicals that act like your body's own local mail service. They're not like hormones that travel all over the place. Nope. These guys deliver urgent, local messages right where they're needed, and fast. Now, scientists have a name for these messengers. They call them Autacoids. It basically means self-remedy. The easiest way to think of them is as local hormones. They get made in one spot, they do their job right there, and they're cleaned up, all in the same neighborhood of your body. And that local action is exactly what makes them so interesting and so powerful. These messengers come in a few different chemical families. And as you can see right here, our two main characters for today, histamine and serotonin, they both belong to the amine group. So let's kick things off with histamine, the one most of us are, unfortunately, very familiar with. Histamine. Yeah, for so many of us, that word just means itchy eyes, a runny nose, sneezing, you know the drill. It's the chemical that gets all the blame for allergies, and honestly, for very good reason. Its story is usually one of a dramatic and, let's be real, a pretty miserable overreaction. But here's where it gets really interesting. Histamine isn't just a one-trick pony. It's actually a super busy molecule with a couple of very different jobs. And the job it does? Well, that depends entirely on which docking station, or what we call a receptor, it decides to plug into. So let's look at its first job. When histamine connects to what's called the H1 receptor, which you find in places like your lungs and your brain, it kicks off all those classic allergy symptoms. But look closely at that second line. In the brain, it also promotes wakefulness. Now hang on to that thought, because that is a crucial clue for later. But then, histamine has this whole other career. When it binds to a totally different docking station, the H2 receptor, which is found in the stomach, it does something completely unrelated. It tells your stomach to start pumping out digestive acid. It's the exact same messenger, but a completely different message, all because it plugged into a different receptor. Okay, so if histamine is causing all these problems, the solution seems pretty straightforward, right? Just block it. And that's exactly what antihistamine drugs do. But this is where the story gets really clever. Because as our science got better, so did our ability to block these receptors with incredible pinpoint precision. And this explains everything. The first-generation drugs, like Benadryl, are great at blocking that H1 allergy receptor. The problem is they're small enough to sneak past something called the blood-brain barrier. Think of it like a super strict bouncer at a club for your brain. Once they're inside, they block those H1 receptors in the brain too, the ones we need to stay awake. And the result? Drowsiness. So then came the second-generation drugs, like Claritin. They were specifically designed to be too big to get past that bouncer. They still block the allergy receptors all over your body, but they can't get into your brain. No drowsiness, problem solved. But you know, getting drug design this precise is a really high-stakes game. This note here shows that some of the earlier antihistamines actually had to be pulled off the market because they caused dangerous heart rhythm problems, a side effect called QT prolongation. It's a really stark reminder that tweaking these tiny molecules can have huge, and sometimes unintended, consequences. Okay, let's switch gears and talk about our second secret messenger, serotonin. Now, if histamine has two jobs, serotonin is like the body's Swiss Army knife. Seriously, it's involved in this incredible range of functions all over the body. Everything from your mood to your digestion to even blood clotting. It does so much. So let's just do a quick tour of its main jobs. First up, in the brain. Here, serotonin plays a key role in managing migraines because it can constrict blood vessels. During a migraine, those vessels tend to swell up, so getting them to narrow back down is a huge part of fighting the pain. Next, let's go to the gut. Down here, serotonin is basically the traffic controller. It helps keep the whole digestive process moving along smoothly, making sure everything flows just like it's supposed to. And finally, in a little spot in your brainstem, serotonin acts as the body's big red nausea alarm. It's the messenger that triggers the vomiting reflex. Now, that's a crucial protective reflex for sure, but it's also what causes that intense nausea people experience from treatments like chemotherapy. So, with all these different jobs, how in the world can we possibly use serotonin to create treatments without causing chaos? Well, the answer is exactly the same as it was for histamine. We get super specific and target the individual receptors. We can design drugs that act like a key to turn a function on, or like a plug to block it completely.
Okay, so for a migraine, we need to turn a specific function on. Drugs called triptans are designed as agonists, which means they act like a master key for the very specific serotonin receptor that constricts blood vessels. They turn that function on, the vessels narrow, and that helps relieve the awful pain of a migraine.
Now, for nausea from chemotherapy, we need to do the exact opposite. We have to block the signal. So, we use drugs called blockers or antagonists. These act like a plug that fits perfectly into the nausea receptor. Serotonin tries to dock, but it can't. The vomit signal is never sent, and patients get incredible, life-changing relief. It's just so elegant. So when you step back and think about it, isn't that just amazing? The very same molecules that are the source of so much of our suffering, allergies, migraines, nausea, are also the precise keys to our recovery. It all comes down to understanding the message, the location, and that very specific docking station. Thanks for listening.